Taylor Swift recently shared that her dad had to undergo quadruple bypass surgery. Now, I admit that I am not a huge Swiftie. Honestly, I would have trouble naming just one of her songs. But I do really love that she came out publicly about this, because this is more than just celebrity news. It is a great public health moment. With millions of fans listening, her choice to talk about her father's experience brings public attention to something that does not get talked about as often as it should. As a registered nurse and health educator, I love moments like this. It gives us a chance to raise awareness about issues that can be prevented or caught earlier with the right knowledge and tools. That being said, it is unfortunate that Mr. Swift's heart disease had to progress to the point of needing a quadruple bypass. That even someone with his immense resources, and by that I mean having a billionaire daughter, that his heart health was still able to get pretty dire. I worked in post-op cardiac surgery for over 5 years and have witnessed firsthand how difficult recovery from open heart surgery is, both the cases that go well and especially the ones that don't. This is a major surgery. It involves cracking open the chest, stopping the heart, and running all of your blood through a machine while surgeons reroute your coronary arteries. It does save lives, but it is not something anyone wants to go through if it can be prevented. Taylor mentioned in the interview that her dad's EKGs had always been normal. And it wasn't until he had a stress test that his advanced heart disease was discovered. So why did his heart disease get so advanced, and why did it go undetected in those EKGs? I think that most people think that a normal EKG means that your heart is fine. But as we just found out, that is not always the case. So in this video, I am jumping on this teachable moment to explain what an EKG actually tells us about our heart, what it can miss, and why it is still a valuable test. I will also talk about the different types of stress tests, like the one that likely saved Mr. Swift's life, and help you understand when they might be worth asking your doctor about. And of course, I'll also spend some time talking about preventing heart disease in the first place, because the ultimate goal is always to keep that heart healthy so that this does not become a concern in the first place. Let's start with the basics. An EKG, sometimes called an ECG or electrocardiogram, is a test that records the electrical activity of your heart. It is painless, quick, and widely available, which makes it the old standby test for heart screening. And even though it did not pick up Mr. Swift's heart disease, an EKG can still tell us a lot. First and foremost, an EKG can detect certain arrhythmias, like atrial fibrillation, which is one of the most common heart rhythm disorders. It is really important to detect atrial fibrillation early because it can cause blood clots that travel to the brain and cause strokes. So that right there is one good reason to get an EKG. EKGs can also show heart blocks for other issues with the way that the heart's electrical system is functioning. And in some cases, it can give us clues that someone may have reduced blood flow to their heart muscle, especially when they are actively having symptoms during the test. So it is also an important tool for identifying heart attacks, both ones happening right now and sometimes even ones that have occurred in the past. I have met patients who didn't realize that they have ever had a heart attack until it was picked up on a routine EKG. This can happen with those who have diabetes or other people who have some type of nerve damage that causes them to not feel the classical chest pain of a heart attack. Also, sometimes women don't experience chest pain and brush off nausea or back pain, which are their signs of a heart attack. They then only found out that they had a heart attack months later when they get a routine EKG. And when someone comes into the emergency room with active chest pain, that EKG can give us vital information, like whether it is the type of heart attack that needs urgent intervention or a different type of heart attack that still requires prompt care, but does not need to be rushed off emergently to the cath lab. An EKG can also pick up electrolyte imbalances like potassium or calcium, which play a big role in how your heart conducts electricity. And for people with pacemakers or those who are on medications that affect heart rhythm, it helps monitor effectiveness and can also pick up on any unintended side effects. So, an EKG is a very useful test, but it is also just a snapshot. It shows what's happening electrically in your heart at one moment in time. And if someone has intermittent arrhythmias, like they go in and out of atrial fibrillation, then they're in a normal rhythm when the EKG is done, and it will look completely normal. An EKG also does not show how well the heart is pumping or give any visuals of how the heart structure looks. So if you have a valve problem or a congenital defect, that will probably not show up. And even if you have blockages in your coronary arteries, but they aren't severe enough to reduce oxygen to the heart muscle, that might not be caught by an EKG. And that is probably what happened in Mr. Swift's case. So I don't want to speculate too much without knowing the full medical details, but it's very possible that his heart did look completely normal on EKG because he wasn't having any active symptoms and the blood flow wasn't reduced enough to affect the muscles of his heart. So yes, an EKG is not a perfect tool, but it is still a very important one. It is often the first test that we run for a reason. It is quick, it is non-invasive, and it provides valuable insight. We just need to understand what it can and can't tell us so that we know when more advanced testing might be needed. So how do we catch heart disease before it turns into something more serious, like needing heart bypass surgery? Well, there are several types of tests that doctors can use to evaluate heart health, and I have other videos on my channel that talk about those. But since Taylor Swift specifically mentioned that her dad's condition was finally detected with a stress test, I want to focus on that in this video. Stress testing can reveal problems that often go undetected when the heart is at rest. A stress test helps us see how the heart performs under pressure, and that can uncover blockages or dysfunction that a resting EKG might miss entirely. The most common type is the exercise stress test. This is where you walk on a treadmill while your heart is monitored. As your heart begins to work harder, doctors watch your EKG to see if there are changes that suggest reduced blood flow. This matters because some blockages in the coronary arteries only reveal themselves when your heart is under strain. At rest, your heart might be getting enough oxygen to look normal, but under stress, those blockages can limit blood flow, and that is when the signs start to show up. Exercise stress tests are typically done in people who are having symptoms, like they're having chest discomfort or shortness of breath with activity. But one can also be done for people with known risk factors, even if they don't have symptoms yet. So, like if someone has a known history of heart disease, or if we know that they have plaque in their arteries, or if they have diabetes or a long history of high blood pressure, or high cholesterol, or if they have an elevated lipoprotein A, which is something I'll talk a little bit more about later on. Exercise stress tests are also sometimes done for clearance before surgery or for people in high-risk jobs like pilots or firefighters. And I'm honestly a little surprised that someone like Mr. Swift, with access to great health care and lots of resources, wasn't doing routine stress testing just because. And I do agree with him that everyone should consider one, especially if they are in a higher risk group. Then there is a more advanced type of stress test called a nuclear stress test. It still involves walking on a treadmill, but this time it includes a small injection of radioactive material so that pictures can be taken of your heart before and after exercise. This allows doctors to actually see areas of the heart that aren't getting enough blood during stress. It's more sensitive than a basic treadmill test, and it is often used if there are abnormal findings in that exercise stress test or if symptoms are more concerning. So I have had a nuclear stress test myself. I had some unusual symptoms, and when I found out that I had an elevated lipoprotein A, which is a genetic risk factor for heart disease, And also because I do high-risk activities like rock climbing and multi-day backpacking trips deep into the backcountry, my cardiologist ordered a nuclear stress test to make sure my heart was handling that stress safely. And thankfully, everything did come back normal. So another version of a stress test is the stress echocardiogram, which combines exercise with an ultrasound of the heart. And this can give us information about how the heart muscle and valves are functioning during stress. While this isn't likely to test that caught Mr. Swift's disease, it's still worth knowing about. And for people who can't physically walk on a treadmill or can't walk on a treadmill to get their heart rate up high enough because of disability or other conditions, there are pharmacologic stress tests. These use medication to make the heart beat faster and harder, mimicking the effects of exercise, so that the same data can be collected. It's an effective and important alternative for those who need it. So while an EKG looks at the heart's electrical activity at rest, a stress test assesses how well your heart functions under strain. This added stress can uncover issues like reduced blood flow from blocked arteries that might not show up when your heart isn't working as hard. That is why stress testing, especially in people with risk factors or if they're having symptoms, can detect serious problems that other tests miss. Now, one thing we can learn from Mr. Swift's story is that by the time you feel heart disease, it may already be seriously advanced. Although we don't know why he had that stress test, it is quite possible that he was living with this advanced heart disease without even knowing it. This is why catching issues early, before they advance to heart disease, through thoughtful screening is so important. It gives you a window of opportunity to make changes before problems escalate. Preventative screening is one of the best tools that we have. Getting your cholesterol checked regularly is a very important first step. When LDL or bad cholesterol is too high, or HDL or good cholesterol is too low, plaque starts slowly building up in your arteries. High triglycerides is another huge risk factor for heart disease. So getting your cholesterol or other lipids under control through diet, movement, and even medication when needed can delay or prevent heart disease from developing or progressing. I have a whole video on my channel that can help you understand cholesterol better, so look for a link to that in the description for this video. Blood sugar is equally important. A fasting blood glucose or an A1C, which shows your average blood sugar over the last 2 or 3 months, helps to identify prediabetes or diabetes early. Elevated blood sugar damages blood vessels, accelerates plaque buildup in the arteries, and increases the risk of heart attack and stroke. Maintaining a normal blood sugar keeps your heart safer. Getting your blood pressure checked regularly is also important. High blood pressure is often called the silent killer because it frequently causes no symptoms until damage is done. Undetected high blood pressure can really cause havoc not only to your heart, but throughout your entire body. But getting screened regularly can catch elevated blood pressure early. You can then bring it down with lifestyle changes and, if needed, medications to protect your heart and vessels before damage becomes too advanced. Now, one specific lab test that you might not have heard about, but that I believe deserves more attention is lipoprotein A, also called Lp(a). It's a type of cholesterol that is mostly determined by genetics and can significantly raise your risk for heart disease, even if your other cholesterol numbers are normal. Unfortunately, it is not something that most people are ever tested for, but that is changing. More and more cardiology experts are now recommending that everyone get their lipoprotein A tested at least once in their lifetime. It is a simple blood test, and knowing your number can help you and your doctor make more informed decisions about your heart health. I just released a video with insights from a major medical conference that focused heavily on this, and I will link to that in the video description if you want to dive deeper into it. All of these preventative screenings that I just mentioned help you and your doctor identify heart disease risk factors and take steps to lessen your risk before the development of serious heart disease. The main goal is to prevent heart disease before it happens, not treat it once it does happen, or let it get bad enough that they need to crack your chest open for a quadruple bypass. While screenings help us catch problems early, it is your day-to-day habits that truly shape your long-term heart health. You've likely heard all of the usual advice like eat healthy or move more or manage your stress better. So let's just take a minute to talk about what those things actually mean in a realistic, doable way. First, regular physical activity is extremely important. The goal should be to move more and sit less. Many experts are now calling sitting the new smoking, as too much of it can increase heart disease risk just as much as smoking. Moving more and sitting less throughout the day reduces your risk for cardiovascular disease and improves blood pressure, blood sugar, and inflammation, which are all factors that can increase heart disease risk. Start with what is realistic for you. Get up and walk during phone calls, or just take the stairs instead of the elevator, or park a little farther from the entrance of the store. If you're watching TV at night, get up and move during the commercials. The goal is to interrupt long periods of sitting and create movement habits that feel doable in your daily routine. Nutrition also plays a central role in prevention. Meals built around vegetables, whole grains, legumes, lean proteins, and healthy fats lower inflammation and support healthy cholesterol levels. Ultra-processed foods, excessive added sugars, and poor quality fats increase your risk for heart disease. Again, start with small steps like adding a serving of vegetables to one meal or swapping out one processed food with a whole food. Sleep is also critical. Poor sleep disrupts nearly every system in the body, including heart health. Aim for quality sleep, both in hours and consistency. So go to sleep and wake up at the same time every day. If you are sleeping poorly, address it. Things like insomnia, apnea, and erratic sleep patterns all strain the cardiovascular system. Chronic stress is another direct threat to your heart. It raises blood pressure, increases inflammatory markers, and interferes with recovery. Build habits into your day that promote nervous system regulation. Things like deep breathing, quiet time, or that movement, or time spent with people that you care about. All of these are important tools for prevention. And if you smoke, stop. There is no way around this one. Tobacco is a major contributor to cardiovascular disease. If this is your starting point right now, today, make it your priority. Resources and support are available, and quitting will significantly lower your heart disease risk. Start by talking with your doctor to get more help. None of these need to happen all at once. Small changes can really add up. So start with one small healthy change that you know that you can do and build from there. That's the philosophy behind a lot of my work, breaking health goals into realistic, evidence-based steps that fit your life. Small steps make change more possible so that it doesn't feel quite as overwhelming. Taylor Swift's father going through a quadruple bypass is a good reminder that heart disease can progress silently, even in people with access to top-tier medical care. And while this can be a little scary, the main message here is actually empowering. It is that there is so much that we can do to proactively reduce our risk. If you are feeling ready to take a step toward better health, but not sure where to start, check out my Thrive in 25 program. It is a self-paced wellness course that gives you 25 simple, evidence-based steps. Each one is backed by research and designed to be doable in your real life. You get immediate access to the entire program in one easy-to-use spreadsheet so that you can start where you are and build from there. There was a link in the description of this video if you want to check it out. I have also recently started a Patreon community where you can access bonus content, early releases, and additional tools to support your wellness journey. I'll also be putting a link to that in the video description. If you found this video helpful, please give it a like, share it with someone that you care about, and subscribe to my channel for more practical, science-based guidance to help you live a healthier, longer life. Thank you so much for watching, and as always, please take good care of yourself.